Good evening, everyone. Thank you so much for joining us. We're just going to give everybody a moment or two to log on, and we'll begin shortly. All right. Good evening, everyone. Thank you so much for joining us tonight. In this installment, Susan Loeb-Zeitlin, MD, FACOG, NAMS, is a certified menopause practitioner, director of Weill Cornell Medicine Women's Midlife Center, will be facilitating a conversation with Sonja Blum, MD, PhD, the Director of Memory Disorders and Cognitive Neurology Division at Weill Cornell Medicine, to discuss what you need to know about brain health during the menopause transition and beyond. As a reminder, tonight's session will be recorded and sent to all those who registered. We encourage you to submit your questions in the Q&A section. And it is my pleasure to turn things over to Dr. Loeb. Thank you both so much for being here with us.
Thank you very much, and thank you for joining us this evening as we talk in honor of Menopause Awareness Month. We're talking about a really important topic about our brain and our cognition and brain fog as we go through this menopause transition. So just to introduce this, menopause, as you might know, is a woman's final menstrual period, and the time leading up to it, called perimenopause. Both of these times are often time periods of bothersome symptoms for women. The most common symptoms women experience are the hot flashes and the night sweats, and up to 80% of women experience those. Those symptoms can lead to mood changes, difficulty sleeping, and other health changes. But brain fog can be experienced by up to 40 to 60% of women going through this transition. Often it's described as forgetfulness. It can be forgetting words, names, numbers, stories, and sometimes even an inability to concentrate. So women are concerned often that these are signs of early dementia, and it can be very distressing. And today we're going to delve into this and talk about it in detail. So I am thrilled to be here tonight with Dr. Sonja Blum. She is an associate professor of clinical neurology and an associate attending at Weill Cornell Medical College and the director of the Memory Disorders and Cognitive Neurology Division at Weill Cornell. Can't think of a better person for this. Dr. Blum sees adults of all ages who are having memory, attention, language, and other cognitive concerns, or who have a family history of dementia and concerned about their risks. Her research focuses on mechanisms of cognitive aging and long-term memory dysfunction and traumatic brain injury. So I'm delighted to be here with Dr. Blum to discuss this important topic that occurs very commonly during the menopause transition. So, as I mentioned in the introduction, women are very commonly complain of brain fog during menopause, including difficulty with word retrieval and forgetfulness. So, my understanding is that in studies, there can be seen neuropsychological testing, a decline in memory performance in women undergoing the menopause transition, but women still will generally test in a normal range. So can you speak about the changes and other cognitive changes that women are reporting during this time in their lives?
Yes. Hi. And first of all, I just want to say thank you so much for having me. It's really an honor to be invited and to have this forum to share some information about menopause and brain fog and some of the changes that happen that are not all bad, but we'll talk about it tonight. So in answer to your question, so you've already really just started with the main overview, right? So we see, I use the number of 60%, that about 60% of women that are going through the menopause transition will experience some memory problems. And really, what we see is that these are the types of issues where, yes, there are memory problems, there's forgetfulness, there are concentration difficulties, and there is at times also slower cognitive processing, slower thinking, difficulty processing information as quickly, or holding on to as much information all at once and kind of manipulating it in a quick way that we might be used to normally. But as you also said, it does not necessarily equate to formally just doing terribly on neuropsychological testing, or in more real life, real life measure, because not everybody's going out and getting neuropsychological testing. What it really means is that even if you're struggling a little bit, you're not actually struggling to do the things that you are doing, whether it's within your home or within a job or within your social circle, that you're still able to get things done that need to get done. Or if you're forgetting something, that it will still come to you, that it's not lost completely. Or if you're a little bit, experiencing some slower cognitive processing, you're still able to process.
That name is there, you just can't get it out right away. Is that it?
Right, but it will come to you. Just might be, when you have already turned to something else, and then you say, "Oh, okay, there it is," and it just and that's also one of those things that we really look for when we are, doing an initial interview and somebody comes in with concern. That's one of the major things that distinguishes sort of problematic and really concerning cognitive decline versus something that is more likely to be benign. So if we see these indicators that, even if you're forgetting, it comes to you eventually, the word comes to you, or if somebody's name comes to you, or you're able to get your work done and things, you don't forget your appointments, you don't forget your, kid's birthday, these kinds of things are indicators that it might be within normal range rather than pathological. Yeah.
Gotcha. So as I said at the beginning, obviously this is not the only thing that's happening in women going through menopause, right? A lot of women will experience the vasomotor symptoms, which are known as the hot flashes and the night sweats. Sometimes they have poor sleep, they have mood changes. So how do these symptoms relate to the brain fog that that women experience?
But that's a really great question. It's a really important question also to lead us into a new arena of research and understanding of the relationship of brain and the menopause transition. And some of it, we're really lucky to have Dr. Lisa Mosconi here at Weill Cornell, who's really spearheading fantastic research and understanding women's brain at the time of menopause transition. But, ultimately, the story that's unfolding is that it's a neuroendocrine change, right? So we have the hormonal system is changing, and the brain is also changing. And there's remodeling of the brain, and we're learning about some things we've known for a while, that there's some structural changes in the brain. There's also some functional metabolic scans. I think in the last 5-6 years, we've learned that there's some changes in metabolic function of the brain. And now, as of this summer, we have, fascinating new research result also from Dr. Lisa Mosconi's group, that there are change in the numbers of estrogen receptors in the brain. So there's some real, we'll talk a little bit more about that, throughout this session tonight. But simple answer to how are the hot flashes related to all of this and some of the other systemic changes? Interestingly enough, they're also related to brain function. So hot flashes are related to a brain region called the hypothalamus. And so some of the ways in which all of this plays out is really kind of at the core, it is a hormonal and brain change kind of hand in hand.
Yeah, it's so interesting because my understanding is that women with hot flashes alone might have worse cognition, even if they're sleeping okay, independent of sleep will be another topic, but just hot flashes can be a risk factor for just some brain fog.
Right. And we're only beginning to understand those relationships. And it is very important. Yes.
And then you throw in women who are not sleeping, so that is going to contribute also.
Yes. And so, sleep is disrupted. I mean, we know that women really tend to struggle, at least in the beginning of the transition, when there's a lot of this kind of new decline in estrogen, and there is a significant difficulty in sleep in various ways, staying asleep, falling asleep, just sleeping overall fewer hours in a night. And all of this can have significant impact on memory because fascinating thing about memory is that a lot of the consolidation of memory, so really stabilization of information that goes from really short-term experience during the day, or during sleep, there are these neuronal networks that have experienced something. They tend to sort of, in simple terms, continue to reverberate together and sort of to oscillate and this is happening in very complex and interesting ways during sleep. And so sleep time is very, very important for normal processing of memory and for moving from something that is stored for short term into something that will be there for the long term that we can easily access. So when sleep is disrupted, we can predict, and we see this in various ways in the memory clinic, not just in patients who are experiencing menopause transition, but people who come through with sleep apnea, for example, very famously, or other reasons where they're sleep deprived and sleep is not functioning well, that memory is taking a hit. And so some of those, at least sleep related hit into the memory system, is something that we very much see as a reversible kind of part of this transition. But some of those problems do improve when sleep is regulated again.
Especially sleep apnea is a reversible form, and we sometimes see that coming up more in menopausal women as the body composition changes. So that's an interesting one. I was just going to say, my mother wasn't so wrong when she told me not to worry that my baby was sleeping so much because his brain was growing. So the value of sleep can't be underestimated. It's so important, and so important as we go through all stages of our lives, right?
It's very, very important. And it's so interesting that, I think that for a number of years, even when I was younger, it was just this, I was raised on, this very Eastern European kind of, you have to get your, 8 hours of sleep. And, but then just really realizing that many people were functioning around me with just this idea that 3 to 4 or 5 hours of sleep it's okay, and that you really prioritize your to-do list, or even prioritize getting up in the morning to exercise over sleep. But now, we know, the more research that comes out on this, the more we know that sleep, it's not a good idea to cut your sleep to do exercise early in the morning, or just, it's really important to get as many of those, as close to 8 hours actually as we can.
Yeah. And of course, we make it sound easy. Of course, for some women, it's really hard, but we've done a webinar on sleep, and we'll probably do another one because it's such an important topic. And there are things that really can be done to improve sleep. So it needs to be stressed. The other common symptom I just want to throw out, as women are going through a menopause transition, and up to 40% of women will experience, are mood changes. And I think mood changes can also impact our cognition. If you want to add something to that.
Yes, absolutely. Absolutely. Mood changes, mood changes turn us in sort of internally, usually there's, whether it's anxiety and there's sort of rumination about, symptoms or worries or depressed mood, it sort of internally turns us internally less attentive to things around us. In order to process information well, so that it successfully becomes part of our memory system, it needs to be what's called encoded. So it needs to really come in successfully. And so when we have kind of a turn away from being able to attend fully to things around us, we are just not receiving the information in as high-grained, high-quality way. So then basically, ultimately, what it means is learning suffers. So to remember anything, our learning curve has to be there, our attention to our environment, to our conversations. And so mood disorders, anxiety disorders, or even, if it doesn't qualify for, a formal diagnosis and treatment, even just transient symptoms of days that are particularly anxiety filled, you sort of are left with less information that stays with you.
That's an important point, because we talk about perimenopause and all of the hormonal fluctuations, and that's probably a little bit sometimes transient mood symptoms. And so that's important to understand also.
Mhm.
That's interesting. Yeah. So it's a whole constellation of things that are important for us to get good cognition, of course. So you talked about Dr. Mosconi, and her research is fascinating. I mean, it was in the New York Times not too long ago, and she really shows the images of the brain and how the brain structure in these are functional MRI studies show changes in a woman going through this menopause transition. But what I've learned from her, I think, and please correct me if I'm wrong, that she's also shown that these are reversible and they do improve after a woman gets through this transition period.
I think that, as it relates to some of the metabolic changes that she's reported on, I think that, but it's really an unfolding story to a large degree. And I think as we well know, I mean, the Women's Health Initiative was a huge effort to study, menopause but really the study of the women's brain and the effect of some of these, of the menopause transition on brain structure, on what's really happening with levels of estrogen and how is, and even, I think the study that was that came out of Lisa Mosconi's research in relation to the metabolic changes in the brain was really the first study that had looked at metabolic changes in kind of perimenopause and menopause period. So it's very much a novel territory. And a lot of the studies also have been sort of cross-sectional and not sort of longitudinal studies, over time. So I think really we will learn a lot more as good research is spearheaded, here with Lisa Mosconi's efforts and across the nation. And it's really an effort now to do this well and to look over time to have properly designed studies that are looking at this. I don't know if we can say with certainty, what is reversible, what is not. We know that the brain is changing. There's remodeling. We know that, for example, this really interesting and very important finding that has come out through the Mosconi group research is, the increase in the levels of estrogen receptors in the brain. And this is really a very novel findings that's been published this summer. And so we know that the post-menopause brain has a much higher density of estrogen receptors. And we will learn more about this unfolding story over time. But, one of the things that's really important and exciting is that, I think that there's a lot of fear that as women that we have about the menopause transition, what it means. And it's really poorly understood still. It's understudied, and I think that the important and really exciting thing to look at now is that we're learning more. And also that, menopause is not, it's not a disease state. It is a change. The brain is changing. There are also other periods in a woman's life where the brain and the endocrine system sort of co-changing together. And this happens in puberty for the first time. This happens in pregnancy. And there are also some changes which, it's not really talked about much, but even at the time of puberty, there are some cognitive changes, and there's also cognitive fog that's kind of maybe underestimated or mild, but this is something that is when we look at some of the symptoms that are experienced even in very young women at the time of puberty and also during pregnancy. And so obviously we know that these changes are reversible. And so we will learn more about what is reversible, what is not reversible in the menopause transition, but so much more to be learned. And also it's not all, there are also some things that are sort of positives in terms of what happens to a woman's brain post-menopause, that there seems to be an increase in emotional resilience. There seems to be also evidence that there is increased empathy, but the emotional resilience is a big piece, and there's an overall increased level of happiness, or just, I guess maybe happiness isn't kind of an overloaded term, but that there is a greater satisfaction with life, and a greater emotional resilience, and that's not something to overlook. I mean, that's an important positive.
Yeah, it's nice to bring out the positives, and I think that's right, as it goes along with, the aging process too, to kind of have those perspectives. And so it's nice to know that that actually is seen in the brain, right?
And just one more thing that I just want to, just mention, just because this is also an area that we really have a lot more to learn about, but it's really research. Most of what we know about the brain has studied the male brain, both in human studies as well as in animal studies. And I can also speak to that as a former bench researcher, studying in a rodent model, that we only ever used male rodents. It's and that's just the lay of the land, and that's really what we know most. A vast majority of what we know about the brain is from male brains. So there's a lot to learn that we don't know about women's brains. But one thing that we know about memory in women and men is that, interestingly, when women, premenopausal women, and up to kind of a perimenopausal middle age, seem to do better on verbal memory tasks, and that with menopause, that memory advantage goes away. But we're really learning about what it all means, and I just want to emphasize for the women who are listening and watching that that this wealth of information that's emerging is going to help us navigate this, and learn when and if treatment is needed, and how to do that, but also that change does not necessarily equal a disease state, even though there might be some vulnerabilities that emerge.
The brain is so fascinating, and so much of what we know has been studied on men. Same with cardiovascular disease, right? So aren't we lucky that menopause is having its moment, and people are starting to look at women and the changes in women?
Absolutely.
Yeah.
I mean, it's very, very important, and I'm very happy to that we're in this time when this is actually happening now in a very real way.
And you mentioned the estrogen receptors in the brain. We'll get to hormone therapy in a second, because there are
Yes.
questions that are coming in
Yes.
about that. But I do think this is probably one of our most important questions right now. And you alluded to it a little bit, that it's just, these are normal, healthy changes. But as I said at the beginning, women are often concerned that they're experiencing dementia. Dementia before the age of 65 is so incredibly rare, right? Like 0.3% of dementia occurs before the age of 65. So it's not likely that this is dementia, but how do we tell normal aging versus dementia? And how do we know if a woman is having a problem?
Well, I think, as I mentioned before, and I think we kind of touched on this at the beginning, that whenever somebody feels that there's a real problem, we obviously we have to be very, very clear about the fact that there's a long history of women's symptoms being dismissed, and so the idea is not to be dismissive of the symptoms. However, there are certain thresholds, to be mindful of. So I do think that it's very reassuring if, the cognitive fog is, for example, if you find that it might track with sleep, if you get that better night's sleep, that you do better, that or that and ultimately that you're not failing at the things that you need to do, that there's no real, if you are functioning in your home and the community and work in a way that you're still able to get everything done and not really slipping, that's very reassuring. However, when something is persistent, you're forgetful in a way that you're having to do new things to compensate. You really have to now use, multiple reminders, and you have to, have somebody else remind, you're really noticing that something is really not right here, and I think people will know. I think that, when there seems to be a real impact on what you're trying to do, I mean, it is time to talk to the doctor, and that's absolutely important. It's, but I also want to reassure women that, 60% of us will experience these symptoms. And so if they're mild, and if they're, especially if it seems like sometimes, tracking with sleep sometimes, or with hot flashes, if you've had, kind of less symptomatic days and you've slept better and things are working better, that, it might be reassuring, okay, this is tracking with some of my symptoms, and it's, but it's not an easy, straightforward question, but or answer. But basically it just comes back to the idea of function, and whether there's a real struggle there or not.
I think that's a really important point, because if I sent every patient to you that I see with brain fog, you
Mhm.
wouldn't have time to see the patients who really have dementia, right? But I
Mhm.
think if what you're saying, and maybe correct me if I'm wrong, if the people around you are noticing it, right, and commenting that you're forgetting things or you're not getting your jobs done, or if you're really not getting things done. I mean, it's one thing, I never
Mhm.
used to have to make lists. Now I have to make lists.
Mhm.
But if it's beyond that, right, that's sort of the point of what you're saying, right?
Yes, and and again, this is, as our biomarkers also get better, as our understanding of the screening tools get better, it may be, a time may come where, sometime in not too far future, where we will be screening in ways that we're not screening right now. But, where we are at this point is a threshold to come into the memory clinic would really be for somebody who's noticing that there is, a problem that's going sort of beyond the, it's harder for me to remember the name, but it still comes to me,
Right.
in 5-10 minutes, or, if it's really moving beyond that. But I also don't want to discourage anybody who feels that there's a problem from reaching for help.
Of course, of
Yeah.
course. So as you mentioned, Dr. Mosconi talks about the neuroendocrine, that the role of estrogen in the brain is really important. It goes along with the fact that we know that 2/3 of Alzheimer's disease patients are women. So
Mhm.
there's very well might be something endocrine in the woman that
Mhm.
is contributing. Again, a lot more research needs to be done to really understand that.
Yes, absolutely. I mean, I think in the past, the link with, more women having Alzheimer's dementia, was often correlated with the fact that longevity, was more common in women, and women lived longer, um, than men, and maybe this is kind of where, the dementia, really sort of caught up with women because of just the length of life. But now we know that's not quite true, and that there might be something else going on there. We're really beginning to unpack it with better understanding of just what's happening with, estrogen receptors. And there's just so much more to learn about what's really happening. What is really what are the vulnerabilities, following estrogen decline? And we're focusing on estrogen because that is really the most, obvious change. We might find out other factors, but we know that estrogen is, very important, for memory function. It also, is related, to promoting sort of levels of certain, protective neurotransmitters that are important for memory function. There's some links with clearance of even links that are made with clearance of amyloid. And so we're learning more about these stories, and there's a lot more to learn about, the vulnerability, following the menopause transition, and to what degree these changes are really, related to this, 2/3 of women, actually 2/3 of Alzheimer's patients, being women.
Yeah. All right. So, of course, we want to know what we can do. So, I'm going to start with the conversation about estrogen, because that's And then we'll talk about supplements and maybe some lifestyle changes that we can do.
Yes.
But hormone therapy,
Mhm.
which we know a lot about now, is indicated. The FDA approves it for specific things: the treatment of menopausal, severe, and bothersome hot flashes and night sweats, for prevention of osteoporosis for women who are at risk of osteoporosis, and for the treatment of vaginal dryness, vaginal atrophy, right? So you didn't hear anything about cognition. So definitely some of the things we talked about in helping hot flashes and night sweats, we might automatically help some mental clarity. In helping sleep, if you're waking up with night sweats, you're going to help your brain fog and your cognition for sure. You might even help the mood with some estrogen or other medication, right? I don't think there are long-term large studies looking at the role of hormone therapy on cognition in women with hot flashes, though. I don't know if you want to speak about what we know about the role of estrogen in memory and cognition.
Right. So I mean, what we know in terms of in terms of this big question, if I take hormone supplements, will I have an edge in terms of prevention of cognitive decline, or to what degree can it be a preventive strategy? And what we do know is that in younger women who undergo menopause due to a combination of, a hysterectomy, oophorectomy, or have had kind of a surgical, menopause, that an estrogen only replacement is actually shows that there's a benefit in cognition in terms of prevention. And so that is that is evidence that we know is that is applicable without any reservation. But otherwise, there is no clear answer in regard to hormone replacement therapy. It's a very, very, very complicated set of stories, and some clinical trials showed some benefit. Others actually showed increased risk of dementia. In particular, giving the combination of estrogen and progesterone, especially and mostly who's been studied are women who are significantly past the point of menopause. So women who are even 10 years or more past menopause, who were included in some of these big trials, including the Women's Health Initiative, which gave us a lot of the answers, initial answers. But now studies are being done, and have a lot more needs to be done to understand what happens when hormone replacement is given at the time of menopause, closer to that last menstrual period, and really studied prospectively to learn and to learn what kind of formulations of hormones. And I think that there's just a lot to uncover. But for right now, what we know is that women who have had surgical menopause and that can receive estrogen only treatment, that is replacement therapy that is that gives a benefit for cognitive prevention as well.
I think some of the studies also show different types of progesterone might be better than others too, but again, it's not clear in the studies.
Right.
And I think that gets to the point that what I just said, the indications for hormone therapy do not include cognitive function or prevention of dementia, because it's just not clear in all of the studies. And I think that's a really important point.
It is not clear. And I think that what's been missed largely in the prior trials, in the earlier trials, is this window that's closer to the age of menopause. So we know a lot more about women who are further away from the point of menopause, and also the doses and the types of estrogen and progesterone that we use. I mean, I think that our thinking on these things is sort of changing, is more refined now, and studies are ongoing to study women who get hormone replacement, at the time of menopause and moving forward, and we will know more as the results of these studies come through.
Yeah, and it's being done. So it's really important that it's
Yes,
being
and these
done.
studies are being done, which is extremely exciting and very important.
There is one thing we do know pretty clearly, though. If you have an early menopause, which is defined as before the age of 40, it's a
Mhm.
very important role for estrogen to take that at least until the average age of menopause, which is about 51 and a half, because it's good for the heart, but it's also good for the brain, is what I think we know.
Yes,
Yeah.
absolutely.
hmm Um, okay, so that's hormone therapy. We kind of didn't leave our viewers with sort of, you have to take hormones because it's going to help the brain, but it will help a lot of the other symptoms of menopause, and in doing so, it might help the brain. The question came up the from a viewer about supplements. So
Mhm.
supplements is a tricky topic. I think there's not a lot of evidence to support it. I wanted to know what your opinion on supplements for the brain are.
So the short answer is that there, if there's a deficiency, in particular, if there's a vitamin B12 deficiency, absolutely, we need to supplement and get to normal levels. However, interestingly, many clinical trials have been done to look at potential benefits of various vitamins and supplements, and so there isn't a clear indication to do so unless there's a deficiency.
Yeah. Um, Magnesium.
Well, I happen to be a fan of magnesium. Magnesium is it's helpful as it has some properties that in very minimal ways, but I kind of think of it almost as kind of a neural membrane stabilizer, potentially, because it's calming. It's calming in various ways. Just it's helpful, for example, in migraine. So pregnant women who have, terrible headaches, what do they get? They get a bunch of magnesium. It's helpful, and in that regard, it's basically it's calming for the nervous system. It stabilizes the membranes a little bit, and it just gives an edge, and getting to sleep more easily, headache prevention. So yeah, I'm a
That
fan of.
definitely can help with sleep too, for sure. So it's not a harmful one. And what
No.
about, right, and what about omega fish oils?
Right. So omegas are important. I mean, omegas are, fish oil is very, very it's the right kind of fat for the brain. It's something that really goes hand in hand with the Mediterranean diet, where we try to eat fish as our main protein and limiting the other kinds of meats. But it's really the idea that why are the fish in the Mediterranean diet so good? I mean, it's really those fish oils that are thought to be particularly important and good for brain health. So
Yeah.
yes, big yes to fish oil. And actually, I'm sorry, but I do have to be just mindful to remind the viewers that because of some of the, sourcing and some of the, mercury and other, heavy metals that can be just, it depends on where it's sourced. Then you have to be mindful of where you're getting your fish and your supplements, basically.
Important point. Okay, but there are things we can definitely do. There's some lifestyle modifications that we can do that can help our brain, but actually I talk about this a lot, just help us as we sort of start our second half of our lives and enter the aging process. I don't know if you want to mention some of the things that we can really do that are good for the brain, but also good for our aging well.
Absolutely. And I will start by, I mean, I already mentioned Mediterranean diet. We can come back to that a little bit later as well. But, I really want to highlight exercise. And we do know all kinds of reasons that are, why exercise is good. And we usually talk about cardiovascular health and some of those benefits and the links between brain and heart. But in addition to that, I really want to share an important point that's not much discussed, is that, exercise is linked to health of a brain structure. It's very important to memory, which is the hippocampus. And hippocampus is one of only two places in the brain where we know that there is neurogenesis, or birth of new neurons. It happens in the olfactory bulb, basically our smell organ, and the hippocampus, which is the core of our long-term memory system. And so in the hippocampus, there are new neurons that are being generated. And so we know from a lot of research that has happened throughout the 90s and 2000s and has continued to show that evidence that exercise is really beneficial to support birth of new neurons in the hippocampus or neurogenesis. As is, and another thing that's really important is enriched environments. So meaning, in animal studies, that might mean, some kind of new colors and toys and things to play with. But for humans, it really means new things to learning, those same things that you hear over and over again. Learning maybe some words of a new language, or learning how to do, or really just going fully in and trying to learn a new language, or learning some new movements. For example, it depends on your physical fitness, but if you're fit enough to learn a new dance, or even Tai Chi or something else that tasks your body with learning a new sequence of movements. So enriching your lived experience through various things that will be novel. So sort of novelty exposure is very important. Also supports birth of new neurons in the hippocampus. And so I highlight that because some of the changes and vulnerability that we see in the menopause transition, hippocampus is particularly sensitive to some of those estrogen changes. And we can really healthy lifestyle that incorporates as much exercise as you can tolerate without inducing too much stress on the body. So those are the balances. We don't want to spike our cortisol too much, but we do want to recommend exercise and the enriched exposure to novel things.
So you're saying, I thought you're saying two things. You're saying learn a new skill, but also learn a new exercise, right? Don't always do the same exercises too for your body, right? That's what you were saying, right?
Yes. And that I mean, I was not necessarily saying that, but I agree with that. And yes, so not necessarily also repeating the same movements in your exercise. It's very good for the body.
Yeah, but I'm fully in favor of learning a new skill. I think it's a brilliant thing to do for so many. It's good for the brain, as you're saying, but it's also just good for the being to learn a new skill at this point in our lives when we've been doing the same thing for a long time.
Absolutely. And just, again, because I may have said some things that the viewers are hearing for the first time, but just to kind of reiterate the point is that, we know that the hippocampus, this memory structure, is vulnerable at the time. It's one of our points of vulnerability in the menopause transition. And so what else can we do to give an edge to our hippocampus and to our memory system is we can kind of give it an extra boost by doing regular exercise and by exposing ourselves to some novelty in various ways. And we can be creative about it. One thing I always tell my patients is you don't have to force, if you're not a language person, don't try to learn a new language. Find something else because it's a combination of novelty and interest, something that's going to be engaging for you, that really yields the result that we're looking for.
I'm taking a pottery class right now. So you talked about healthy eating, Mediterranean, plant-focused diet, right? Lots of fish, right?
Yes. Again, for, vegetarian viewers, you don't, obviously, then you can do omega supplement that's consistent with your diet, but, omega supplements then are very important. And for those who do eat fish or meat, really we are talking about a fish heavy diet and moving away from red meats and other kinds of meats.
Trying to maintain a healthy BMI, that's another one that's really,
Yes.
as best we can. That's not easy, but as best we can.
Yes.
And just maintaining good health, right? Make sure your blood pressure is under control, which can sometimes change during this transition. So important to get it checked. Your lipids, check for diabetes. All these metabolic things can change around the time of menopause. So important for your brains, I think, right, to get those under control.
Absolutely. Absolutely. And I'm also a fan of meditation or other mindfulness techniques, because they can really also go hand in hand with some of the other symptoms and things that occur both in middle age medically, such as blood pressure elevations, as well as some of the issues that we see with mood and anxiety, for example, during the menopause transition. And so if you have not, meditated before, or, just incorporating that, or even some gentle yoga breathing, but developing a daily practice that you can also turn to in moments of stress, that you can find a quiet place and just know a routine or two that can, get your, I speak about it as, from in neurology language, neurologist language, but I really talk about parasympathetic nervous system training, right? So we have the sympathetic nervous system, which is the flight or flight, and we have the parasympathetic, which is our homeostatic, relaxing, our body has time to heal. And, so we, if we don't have a good daily practice of tapping into our calming, centering parasympathetic nervous system, then the important thing is to seek out some ways to strengthen our relationship to that side of our nervous system, and to do and to be able to turn to that when you experience stress, or just on a daily basis for maintaining good health.
And in theory, that should help our sleep, which we've already said is so important for our cognition. So
Absolutely.
yeah, and I did a webinar a couple of years ago on sleep, but one of the things that's just for information that's been shown to be most effective for sleep is cognitive behavior therapy for insomnia, and kind of retraining yourself what to do if you're having insomnia. So there really are things out there that can be done, and it's so important to try to get a handle on that. Of course, the obvious: no smoking, as little alcohol as possible, right? Anything else in lifestyle that
I think we've hit the main ones, and I think, however nice, a glass of wine is at the end of the day, that everything that we're learning about the relationship of alcohol to both cancer risk as well as cognition, it's just that it's, not as neutral as we thought once it is. So even though officially it's still part of the Mediterranean diet, as we always used to say, when I initially trained, it was, fish and a little bit of handful of unsalted nuts and your green leafy vegetables, and you can have a glass of red wine,
right? No.
But now I will only say, I will encourage patients who are not, to not drink, and then, that if you're drinking, that there's some of this evidence that, a glass of red wine might be, more in line with brain healthy choice than some other choices, but certainly moving away from recommending any amount of drinking.
Well, there are a couple of really good questions that are coming up right now. Caffeine, melatonin might help sleep. Caffeine impact on cognition.
I think that caffeine, I don't have a strong opinion other than just reserving it really for the morning, and really limiting it, nothing past noon, as I have my Starbucks here.
Right.
But this is an exception, yes. But really limiting it and keeping it in the morning, because if you're going to have coffee, because it really actually can have a negative impact on sleep, even many hours after it's been consumed. So that's my only recommendation there, and keeping it to 1 to 2 cups.
And there's one more question here, which I find interesting too. So a lot of times we are giving gabapentin off label. It helps with hot flashes and night sweats, and it can help with sleep. Are there any negative impacts that gabapentin has on cognition?
So I'm not, I have to be honest, I'm not a huge fan of gabapentin, in relation to memory. It's a great medicine for, for a number of things. It's great for anxiety. It's great for restless leg. It's great for, some aspects of menopause transition symptoms. And that's, I think that it really depends on the patient. So I think small doses in the evening, that's okay. But, you know, anybody who feels that they have any kind of hangover effect from it, or when they take it to feel, you know, if they feel any impact on cognition, then they might be better fit for something else. But it's basically, it's a great medicine for a number of things, and I do use it, but I'm cautious about the cognitive side effect.
That's what, yeah, that's, I thought that was a good question that came in.
Yeah.
So we could go on forever because obviously this is such an interesting, important, real topic that
Mhm.
that so many women are experiencing. I think we covered a lot here. What are your take-home messages for our viewers?
Well, also I did not want to ignore the question about melatonin, because I think a lot of us have tried melatonin or wonder about melatonin. You know, the interesting thing is that, you know, like a lot of things, if you take it every night of the, you know, week, and you take it for a long period of time, it's actually, we're learning that it's actually not, it's not recommended. So it's good for adjustments, for jet lag, and to make sure that you don't end up with a lot of lost sleep when you change time zones. And I recommend, you know, you can use it kind of shorter term as you're introducing some other modalities that are going to help you fall asleep. Like, for example, you know, just working on sleep hygiene, introducing magnesium in the evening, and other kinds of things that are soothing, stopping relationship with, you know, screens at least sort of 45 minutes to an hour before desired sleep time. But really, doing melatonin more for shorter term, you know, maybe like a week or so, you know, or a couple weeks. I no longer recommend long-term use of melatonin, because there's emerging evidence that it's not as effective. It can be sort of counterproductive, actually. But for short term, yes.
Interesting.
And takeaways, yes.
Takeaways. And also, just to summarize, I mean, we spent just now a lot of time on sleep because sleep, mood, and cognition are all related. And so there's an intersection of all of them. And so that's why I think that was important for us to spend the time on the sleep. Yeah.
Yes, absolutely. And you know, and again, that's a whole other, I'm glad that you're going to be doing a webinar
We
on
did it. We did it
sleep. Oh, you
already.
did it. You did it. Okay. But very, 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 very important. Yes. So I know we just have a few minutes left, but you know, take home messages. You know, I some of the things that we know are an emerging story. So just for all of us to kind of keep our you know, attention on what's coming next. But we know that the brain is changing, and we're learning a lot more about what is really an endocrine and neurological event that happens at the time of menopause. So the hormones are changing. The brain is also changing. We know that estrogen receptor density goes up, and we know that there are some changes, and also metabolism of the brain seems like it declines somewhat after menopause, and we're learning more about the reversibility of some of these events, or just what you know, what it means for prevention strategies, how we might intervene to sort of gain an edge at these times of vulnerability, to basically gain an edge in terms of understanding better how this relates to the higher number of Alzheimer's cases in women, and what we can do. So we're going to keep our eyes and ears sort of peeled for data as they emerge from the new studies that are happening. Other things, no easy answer to HRT. So we know that, as you also highlighted, for women under 40 who have undergone, you know, menopause, very important to do the hormone replacement therapy. And you know, just in general, younger women who have had surgical menopause and do not have a uterus and can have estrogen only treatment, that we do know that that is something that can support sort of cognitive wellness. But we do not have that evidence on the whole in terms of use of estrogen progesterone combined therapy. So it's currently not recommended, but we're going to learn more as research comes through. And I really want the viewers and you know, to remember that menopause is not a disease state. It is a time when the brain is changing and remodeling, and we're learning much more about it. And that there are also some some points of increased resilience after the time of menopause, including, this evidence that there is a greater emotional regulation, greater emotional resilience, and even this greater sense of satisfaction with life and empathy, which are both, positives.
That is amazing. So interesting. I will add to you also that brain fog is so common, not necessarily a sign and not usually a sign of dementia. But if you're concerned about it, you should definitely speak with your provider, because even if it's, there are other things that can be done that might help you with the cognition changes that you're experiencing. And of course, the best things to do are these lifestyle modifications that we just spent a lot of time on, and
Yes.
learn a new skill. I think it's the best thing to do in midlife.
Yes, and as somebody who has researched the hippocampus for many, many years since I was quite young, I can't say enough about just the importance of sort of tapping in. We are in flux with our environment and sort of how we exist within our environments and how we move and what we do. And so the brain is also in the hippocampus with new neurons are being born. Things are also not static, and we can intervene in certain ways to help these brain structures do the best that we can during even these times of vulnerability. So, yes.
Amazing. Thank you so much, Dr. Bloom, for being with
Well,
me,
thank
with
you so very
us
much
this
for having
evening.
me.
Thank you for all the work you're doing, and we look forward to more to come.
Thank you.
Thank you. Have a great night, everybody.